How long after gastric sleeve can you drink alcohol? The decision to get gastric sleeve surgery is an important one that can be filled with fear and anxiety in addition to hope and anticipation. It's not a simple road to travel, but it can be a very rewarding one. When the surgery is finished, emotions change. The surgeon's job is done, and now the patient must do the hard work. Many of these thoughts are related to foods and drinks or, more especially, what exactly is and isn't off limits now. For example, alcohol tends to get brought up often in esophageal diets, and bariatric patients need to understand how the gastric sleeve and alcohol influence each other. What is a gastrointestinal sleeve? Gastric sleeve surgery, also referred to as a sleeve gastrectomy, is a procedure where 60 to 80% of the stomach is removed. The part of your belly that remains is all about the size and shape of a banana. This is designed to help you shed weight since it will dramatically lower the quantity of food you can eat at one time. It's important for individuals to know what they can and can't consume after having a gastric bypass. After the initial recovery is complete and your surgeon releases you, you ought to have a fantastic idea of what your daily diet should include. This is because the way that your body processes foods and drinks differ after surgery, and this includes how alcohol is processed. Here's what you can expect when combining a gastrointestinal sleeve and alcohol. Alcohol and nausea. Don't be alarmed if ingesting alcohol makes you nauseous. If that's the case, stop drinking and use anti-nausea remedies to reduce vomiting. However, if alcohol routinely induces you to become nauseous, it can be something that you want to avoid completely. Alcohol and nausea. You will probably inhale at some point following your gastric sleeve surgery. Sometimes, this results from expected nausea, and in rare situations, vomiting can be caused by a complication with the operation. Although you are unlikely to harm your gastric sleeve by vomiting, it may cause your belly to become inflamed and swollen, which can exacerbate unpleasant side effects. Since drinking alcohol following a gastric sleeve operation can get you greatly drunk quickly, it's not difficult to attain the point of vomiting with drinking. Look after your gastric sleeve by preventing nausea when possible, especially from alcohol. Precautions to take when drinking alcohol after gastric sleeve operation. There are lots of precautions you must take when drinking alcohol after a gastric sleeve procedure. Avoid drinking alcohol at all during the first year following your gastric sleeve surgery. That is when weight loss occurs the most rapidly and if you'll become the most sensitive to alcohol's intoxicating effects. Always have someone you trust with you in the event that you choose to drink. This individual should know that you have had a gastric sleeve operation and understand the way that impacts how you consume alcohol. It's also helpful if this person pledges to remain sober to supply you with a ride home when needed. Be careful not to overdo it. Plan beforehand how many drinks you'll have, and be sure you're giving yourself plenty of time between drinks. Make sure you eat a meal before you drink. Are gastric sleeve patients at a greater risk for alcohol use disorders? Some resources imply that in many cases, obesity is caused by an addiction to food, and following bariatric surgery, the dependence remains present but is transferred to a different material, such as alcohol. However, if that were true, most if not all instances of bariatric surgery would end in addiction or substance use disorders. The truth is that the number of gastric sleeve patients that report alcohol use disorders is modest compared to the entire amount of bariatric surgery patients. In the event you drink alcohol with a gastrointestinal sleeve, drinking alcohol with a gastric sleeve is a personal choice and can be secure when done in moderation and with care. After you have completed the initial healing period, there is nothing that contraindicates moderate and responsible alcohol use after gastric sleeve surgery. Before you fill out your glass, however, It is always a good idea to consult with your physician to discuss alcohol use in your particular case.